floss in and out really quick like this. That's not getting to where the plaque is. So you want to
That's true. The way you have to floss is this. You go like a C shape and wrap it around the gums. And if it bleeds, it's not because of the floss, it's because you've been doing it wrong.
Under the gums. If you see bleeding, that's gingivitis. That's an
Gingivitis is inflammation of the gum.
Or more thoroughly to clear up that bleeding.
Let's close this gap. So we start with accurate measurements to ensure the new shape of the teeth will be symmetrical. Dr. Daniel is using direct composite veneers, and this is where composite is layered over the full front surface of the tooth. Throughout, we take reference measurements to ensure that it is in keeping with the original design, and here is the final result.
How does a dentist fill in between your teeth? These cavities usually happen because you don't floss. We drill the cavity out, clean it, and then put in the composite, shape it, make sure that we put that plastic matrix band in between so they don't get connected to each other. Light it, polymerize it, and then polish. What is this weird worm-shaped thing underneath the gum? As a dentist, we put it in to separate the gum from the tooth so we can see better, get better impressions and scans. And don't worry, we remove it and everything is reversible. More often when we remove the braces, we see lots of cavities around the bracket in the shape of rectangular or triangle. And that people would blame us as practitioners because of those cavities, or they would blame the braces itself. But the reality is that you didn't clean around the brackets well, and food got stuck around it for long and started creating cavities. It didn't go under the bracket because there was cement there. These are lingual braces. These braces are toward your tongue, so it doesn't look too bad from the outside. You can't really see them. The thing about them is placing them is very hard. They annoy your tongue so much and they can cause a bit of scarring in there, but it is good for people who don't want their braces to show. The other option would be Invisalign.
You can use these interdental brushes to clean in between your teeth when you have braces on, because when you take the braces off, you don't want to find cavities between. If you have braces, you might have had these rings around your molars. The dentist will first place these separators to separate the teeth to make room for the bands to go around the molars and move them. How do we do root canal treatment? This video is really cool because you can see that area that looks like a butterfly at the bottom is where the pulp chamber is, and pulp chamber is basically a room within a tooth that holds all the nerves and blood vessels that keep the tooth alive. Now, due to any reason, if you have inflammation inside this chamber or infection, for example, because of a cavity or because of a gum disease, you then will have a lot of pain usually. The nerve is inflamed, it's angry, it's hurting you, it's throbbing, it doesn't let you sleep at night. So the dentist will recommend a root canal treatment. When it comes to this point, the only other option is to pull the tooth out, because somebody has to get rid of that nerve inside the tooth so you don't feel the pain anymore. Now, either we only remove the nerve or we remove the tooth altogether. Why do we do that? To be able to subside the pain and keep the corpse of the tooth over there basically for longer, so you can use your teeth and keep your tooth. Remember that root canal treatments have some percentage of failure. They're usually not forever, and it'll just elongate the tooth for you, the lifespan of the tooth for you, until at some point you might lose the tooth. If you don't want to have a root canal treatment, the best thing to do is to have an amazing oral hygiene. Floss every night, brush your teeth after flossing, see a dentist every 6 months, and get your regular x-rays. Make sure that the dentist can see beneath the surface. Do not worry, the x-rays are quite safe. Yes, they have a bit of radiation, but their radiation is so small that it's comparable and less than a flight you might get from Melbourne to Sydney. Now here the dentist is removing all the amalgams first, which is the silver filling on the surface of the tooth, and then they're gonna slowly reach the pulp chamber while the nerve lives. At this stage, you won't feel anything because your tooth is completely numb. If you look on the right side of the tooth, you see that brown kind of stain coming inside. That's the cavity. That might be the cavity that caused this whole problem. It might not be, but you can see it's on this side. So basically it shows us that maybe the patient didn't floss regularly, and that's why they got a cavity on the side of the tooth. Now, the dentist is getting rid of all the debris and germs and bacteria, and then later on they're going to remove that roof on the surface of the pulp chamber and get the nerve out. That procedure Removing the nerve and replacing it with a filling is called a root canal treatment or a root filling. Slowly getting lower. And if the pulp is alive, usually at this stage, there you go, it ended up in the nerve. At this stage, we would see bleeding. So removing the pulp horns, which is those little antennas you can see there now, and getting rid of the roof of the pulp chamber so we can get more inside and remove more debris and the infected nerve. If you have braces, you would see these colorful things around the teeth that are called O-rings. They hold the wire inside the bracket, making sure basically your teeth are attached to the wire. We usually change them once a month, once every 2 weeks, to make sure that the wire sticks inside the brackets so you can make sure that your teeth keep moving every day of that month.